About 10 more seconds, everyone. Thank you for your patience. My apologies for the delay. Well, good afternoon, everyone. My name is Nirav Shah, and I'm the director of Maine Center for Disease Control and Prevention. And I am delighted this afternoon to be joined by Director Jessica Pollard, the director of Maine's Office of Behavioral Health. Given all of the behavioral health implications that we have all discussed with respect to COVID-19, as well as other behavioral health matters ongoing across the state, delighted to welcome Director Pollard to join us this afternoon to talk about where we stand with respect to COVID-19, the holidays and holiday stress, and some tips for everybody. I'll start by providing an update on where we stand epidemiologically and then turn it over to Dr. Pollard. To start us off, unfortunately and sadly, Maine CDC has received the reports of 3 additional individuals who have died with COVID-19. One was a man in his 80s from York County. Another was a man in his 70s, also from York County. And the third was a woman in her 70s, also from York County. Their deaths mark collectively the 324th, 325th, and 326th deaths associated with COVID-19 since we began our activation. I'd like to take a moment to offer all of their families, friends, and communities our deepest condolences during this time of their grief, 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 during this time of their grief. There was an audio glitch there. Right now across the state, there have been a total of 22,319 individuals who have tested positive for COVID-19, representing an increase of 439 cases since yesterday. Of those, 19,128 are confirmed cases and 3,191 are probable cases. I'd like to take a second to talk about those recent increases, as well as what we possibly may anticipate with respect to new COVID cases in the coming days and in the coming weeks. First is that if this holidays weekend mirrors last month's holiday weekend, it is likely, if not probable, that there will be an increase in the number of new cases in the coming days. There are many reasons for this. One is that laboratories themselves across the state and across the country may be themselves working through one day of tests that didn't get run because many of them took the Christmas holiday off. The other thing is that as folks return to Maine and need to get tested to return into the state per Governor Mills's executive orders, or in other instances, to get tested because they may feel symptomatic or they may have learned they were exposed during the holiday, we expect there to be an increase in the number of tests. As is so often the case in public health, when you go testing for something, you can find it. And thus the increase in the number of tests may bring with it an increase in the number of cases. There's also the fact that we at the state level are continuing to improve the way that we review cases and positive lab reports as they come in. All of that coupled with the fact that close gatherings, which are typified during the holiday season, be it Thanksgiving or last week's holidays, often present opportunities for spread, and thus that in and of itself may lead to a higher number of cases. All of those factors point in the same direction, which is that the bottom line is that there is a high likelihood of an increased and increasing number of cases across the state of Maine in the coming weeks. That is a risk, and it is one that we are prepared for within Maine CDC, but it's also an opportunity to remind everybody that if you've just returned from, say, a holiday gathering, and you've learned that someone at that gathering has now tested positive for COVID-19. You as a close contact can do a couple of things immediately. The first is make sure you go get tested. The optimum time to get tested is approximately 5 days after your last interaction with someone who is now positive. The other thing you can and should do is stay indoors to avoid the likelihood of further transmitting COVID across the state. Turning back to the numbers, as I mentioned a moment ago, there have been now 326 individuals who have died associated with COVID-19, and cumulatively 1,032 individuals who have been hospitalized. Right now in Maine, 181 people are currently in the hospital with COVID-19. 48 of them are in the intensive care unit, and 14 of them are on a ventilator. Among all of our cases, 2,415 are among healthcare workers. Turning to a moment to discuss some recent outbreaks that Maine CDC has opened. There are two that I wanted to comment upon today. The first is an outbreak investigation that we opened earlier today at Sheepscott Village Daycare, where we are aware of 3 cases. This is a small private childcare program in Newcastle in Lincoln County. We have started working with that facility ever since detecting this outbreak. The facility itself shut down on 12/21 and aimed to reopen after they get the all clear from Maine CDC. We have worked closely with them to ensure that they are doing everything they need to keep their facility safe. The other outbreak investigation that we've recently opened is into the ADUSA, or ADUSA, which is a Hannaford distribution center in Winthrop. This is one of 9 distribution centers across the state of this nature. All of the cases are among employees of this facility, and those cases are spread across the facility. Based on what we've seen, based on our initial analysis of this data, it suggests that the outbreak is a function of community transmission that can and has been occurring in and around that area. But given that there are now a total of 21 cases, Maine CDC is taking a hard look at this to make sure that we are providing the facility everything they need in order to reduce the likelihood of transmission beginning or continuing to occur within the 4 walls of the facility. And finally, a quick note on where we stand with respect to vaccines. As of this morning, there have been now a total of 17,180 Maine people who have received their first dose of COVID-19 vaccine. I'd like to take a second to talk about where we are right now with respect to vaccines, and then where we see ourselves going. As I've talked about, we are squarely in the midst of phase 1A of our vaccine rollout. 1A focuses largely on 2 groups, healthcare providers and personnel, as well as residents and staff of long-term care facilities. Our initial focus and where we are focused right now is around those personnel who work in hospital settings, in EMS settings, as well as in home health, to make sure that they have been vaccinated. Overall, those numbers of everyone across phase 1A cumulatively represents approximately 130,000 or so individuals. As of last week, Maine had received approximately 45,000 total doses, so about a third of what we would need to encompass all of phase 1A. Right now, again, our focus is on groups that work in and with hospitals, EMS, as well as home health providers. But very soon, we expect to be expanding our concentric circles of those whom we vaccinate, not just to hospitals, EMS, and home health, but to other providers. Now, I recognize that every single healthcare provider, every single person in 1A is waiting eagerly and anxiously for the day that they can be vaccinated so they can continue providing needed healthcare services to the patients that they serve. I fully understand that, and I get that. We are working as quickly as we can to set up an efficient system whereby those healthcare providers can get vaccinated. We anticipate being able to do so very soon. However, As we've talked about, Maine has received less than what we need to make significant inroads across 1A. Our second and third week's allocations of both vaccines were less than what we initially thought. That unfortunately has elongated the time frame from which it will take us to move through 1A. Right now, the question of when individuals will get vaccinated who are part of 1A is just that. It is a question of when and not if. We appreciate that everyone wants to be vaccinated immediately, and I want nothing more than to be able to vaccinate everyone immediately. But given the supply considerations that we have, as well as the difficult and challenging logistics that we are facing, my view is that it is better to do it right and do it correctly rather than to do it fast and get it wrong. We are planning for that process right now, and again, hope to have additional updates very soon, partly based on what we see our next week and subsequent weeks' allocations looking like. I ask everyone to bear with us just a little bit longer. Again, we will be vaccinating everyone in phase 1A. However, making sure we set up a system that works not just for phase 1A, but also sets us up in a good position for phase 1B and subsequent phases, that's got to be something we keep in mind right now as well. But I'm sure we'll discuss that in a bit. I'd like to turn things over to Dr. Pollard to talk about where we stand with respect to behavioral health, especially during this time of year. Dr. Pollard?
Good afternoon. Thanks for having me. Even without a global pandemic, this time of year can be difficult for many. And even before the stress of the holidays, the COVID-19 public health emergency has challenged our mental health and well-being. You don't have to be a Grinch or even a Scrooge to find the holidays stressful either. There is such a thing as good stress for things that we find positive or look forward to when they come with increased demands. So that can still put a strain on our coping resources when they come with the extra things that we have to do and navigating relationships that right now may come with additional conflicts or disagreements around how to handle gatherings or how to navigate disagreements about the importance of public health measures or public safety measures. So when we layer in COVID-19 and the many, many ways that we've had to adjust our lives in order to keep ourselves and our loved ones safe, it's not unusual to be experiencing a decreased sense of well-being, difficulty coping or getting along with others, disrupted sleep or poor mood, a tendency or temptation to increase alcohol consumption or use other substances. We're creatures of habit, and we can have a hard time with disruptions to routine. Many of us are worried about the health of ourselves or people we care about. Many are experiencing financial hardships or facing increased demands and challenges at work, whether you're a healthcare professional caring for COVID-19 patients, a teacher managing remote and in-person learning, a retail worker interacting with customers who are unhappy with the safety measures, or any number of jobs that are now very different than they were a year ago. Add to that trying to figure out how to maintain the incredibly important social connections, adjusting to or foregoing holiday traditions. It would be surprising if there were many people who were not feeling pretty stressed right now. The good news, though, is that there's a lot we can do to manage stress, to increase coping and resilience, and a lot of resources that we can access to prevent these challenges from becoming worse mental health or substance abuse problems. Our bodies are wired to respond to immediate stressors. We get fired up or we freeze. And over time, if we don't take steps to actively calm down our stress reactions, we can feel exhausted, irritable, tense, have a poor appetite, and so on. We know from research on previous disaster situations that we can see surges in mental health and substance use difficulties a year to 18 months later post-disaster. So it's really important that we get out ahead of it and take preventative steps. Developing simple coping strategies, and practicing them on a regular basis, setting aside time for that on a daily basis for self-care can go a long way. whether that's breathing, relaxation exercises, getting out for a walk in the woods, taking a hot bath, or any other ways that you reset yourself. Please invest this time in at least a little bit each day in your well-being. Some people are vulnerable to mental health and substance use challenges, and their experiences may cross the line into a health condition that needs extra support and treatment. Things such as a low mood most of the time for more than a week or two, difficulty stopping or cutting down on substance use, feeling unable to control temper, sense of hopelessness, struggling to function, having thoughts of harming yourself or others. Those are all times that we think it's important, or we know it's important for people to reach out for help for themselves or for their loved ones. So I really appreciate the opportunity to join the briefing today to let people know about resources that are available and to talk about a couple of programs in particular, Strengthen Me and the Options Program, as well as remind people about the statewide crisis line and the continued availability of most treatment via telehealth, and in some cases in-person treatments. So we have the Strengthen Me program, which is the state's response to the COVID-19 pandemic for well-being and resilience. It comes with a support line, that's 207-221-8198. And that line is for anybody, and we also have specific resources for frontline first responders, healthcare professionals, and school staff. We have the strengthenme.com website, the NAMI teen text line, peer support warm line, and community health outreach workers, as well as a campaign that will be launching soon, and resources from behavioral health providers. So that's available to anybody who needs it. And we've seen over 23,000 contacts through that program so far. So the really great news is that people are making use of resources and reaching out for help. Just briefly, the Options Program stands for Overdose Prevention through Intensive Outreach, Naloxone, and Safety. That includes a campaign that's coming soon, which aims to get the messages out about the importance of not using substances alone due to the risk of fatal overdose. So alternative strategies to using alone, the messages that help is available and where to find treatment, information about the Good Samaritan law so that people don't hesitate to call 911 if an overdose is suspected, and the current dangers of the opiate and other substance supply chain right now. A very high likelihood that substances contain fentanyl, which is just a more deadly form of substances than we've seen in prior years. This program includes teams of clinicians, so substance use counselors, peers, and harm reduction professionals who are partnering with law enforcement and first responders to co-respond when there's a call about substance use, and to follow up if someone's experienced a non-fatal overdose, and actively outreach to people who are at risk, as well as leave behind naloxone. And these programs will be available in each county and are launching really as we speak. So with that, I'll just remind people the crisis line is still available. While it has seen an increase in volume, which suggests that people are experiencing more distress, the other side of that is that means people are reaching out for help for themselves and the people that they care about. And that's true also of our warm lines. We've seen a significant increase in volume, and we've expanded the capacity of that line so that people know 24/7 there's somebody they can call and talk to and get support. So thanks again for having me today.
Well, thank you, Dr. Pollard. Much appreciated. And we will now turn things over to our colleagues in the media. Again, Director Pollard and I are happy to take any questions, whether they be about COVID in particular, now the behavioral health implications as well. To kick us off for the afternoon, I will turn things over to Brad Rogers.
Hi, can you hear me okay?
Yep, go ahead, Brad.
Okay, great, thanks. Dr. Fauci's warning that January could be one of the worst months yet for COVID. You alluded to that yourself. Are Maine hospitals ready for more COVID patients? How are we doing right now?
Yeah, I think, Brad, the answer to that is yes. We have maintained really good and open communication with hospitals through various different planning meetings that occur throughout the week across all of the staff at Maine CDC, Maine DHHS. Hospitals are fully aware of and have seen the same data on the horizon that I've just talked about here. the possibility of gatherings leading to more cases, the possibility of more cases leading to more outbreaks. Hospitals are fully briefed on that. At the same time, I think it's also important to note that, for example, right now in Maine, we have 114 open and staffed ICU beds available. That's a good sign. It means that we've got headroom, even if the epidemic and the pandemic were to worsen significantly. We don't have that challenge right now of needing to, say, stand up a mobile hospital. That is a possibility, and it's one that we continue to plan around. But for right now, our primary aim is making sure hospitals have everything they need to care for within their four walls patients who may be coming their way, testing supplies, PPE, things of that sort. So there will certainly be, if there is an increase in cases, which is to be expected, there will be a concomitant increase in hospitalizations and sadly the possibility of deaths thereafter. But based on where we stand right now, my view is that hospitals in Maine are ready.
All right, question for Dr. Pollard too. Throughout the pandemic, it's been hard for people to access mental health or substance abuse services, at least in person. Are things getting better or worse now with regards to that?
Yeah, I would say that if you want to call a silver lining, if you want to say that there's a silver lining to the pandemic, it's really been the pivot to telehealth that the behavioral health provider community has achieved. We saw on average, for example, that prior to the pandemic, the claims for telehealth visits was somewhere around 800 to 1,000 per week, and that shot up to 90,000 at the peak of the use during the pandemic. So services remain available. It may be challenging for people who are used to kind of walking in somewhere, but our partners at 211 have tracked where the changes in operations are for each provider, so can connect people to telehealth resources. We've seen actually an increase in some of our services during the pandemic. So not only are they available, but more people have been making use of them. And believe it or not, in the year 2020, even though sadly we've seen a couple of agencies close their doors, we've seen far more actually open. So there were a few service closures that people have mentioned over the course of the year, but we've actually seen 12 licensed agencies open since the beginning of 2020 and 27 new service lines throughout the state. So while it may seem surprising to hear, we actually may be seeing a greater availability, and once the pandemic ends in a rural state like ours, we hope that providers will maintain this level of telehealth availability.
Okay, thank you.
Thanks, Brad. I'm going to turn it over to Bob Evans at News Center next.
Thank you, Dr. Shah. How many days did you have to close down the testing facilities over the holidays, and are you concerned about any backlog that may come from that?
Bob, we ran, our staff had the morning of Christmas off. I can only speak to the Maine CDC laboratory, just to be clear. I can't speak to other laboratories at outside facilities, but Maine CDC staff worked late into the evening on Christmas Eve. They had the morning of Christmas Day off, and then by the morning of the 26th, probably before most of us were up, they were back at the lab. As of right now, in fact, I spoke with our lab director this morning. Because of the late night that they put in on Christmas Eve, we started the week, we started on the 26th, as well as this week, now on the 28th, with 0 samples in our freezers and 0 backlog. I don't know simply about what's going on at other laboratories and whether they have found themselves in a similar place. Generally speaking, however, laboratories that operate at this level with this type of samples at this caliber usually don't take many days off. So I'm not anticipating one. What I am anticipating, one being a backlog, but what I am anticipating is a high number of people who are returning, who may need to get tested or who may have been exposed and are now starting to feel symptomatic. I am expecting an increase in the testing volume and starting to see that over the next couple of days.
Okay, thanks. Dr. Pollard, who do you feel should use the services that you mentioned, and how might those services help them?
I encourage anyone to use the services. I mean, this is a different kind of situation than we've seen in previous uses of these kinds of programs that might have been for a confined event, that really just about everybody is affected by the stress of COVID-19 and all of the adjustments. So I would encourage really anybody who is feeling stressed, if they don't already have coping resources that are doing the trick, or they feel like they need to boost their stress management skills, I would encourage anybody to make use of the services. But certainly anybody who's feeling distressed or hopeless should not hesitate to call the statewide crisis line.
Thank you both.
Thanks, Bob. I'm going to turn it over to Amy Brown next.
Thank you, Dr. Shah. I have a couple of questions from listeners. One asks why, and I think I know the answer to this, but why long-term facilities are receiving Pfizer rather than Moderna. I assume that's because Pfizer just was available first. And then they also, the same person wanted to know if the Moderna vaccine is as effective as the others in people over age 65.
So the former question, Amy, is that we chose to use the Pfizer vaccine because the pharmacies that are engaged in that partnership have the cold storage requirements available to them in order to utilize that, which thus frees up the Moderna vaccine for locations that don't have cold storage available. So it was an operational decision, not so much a first in line decision. And it's important to note as we are going through vaccine planning, although we always maintain clinical characteristics front of mind, there are also very technical, operational, and logistics challenges that we also have to keep in mind. So for example, the Pfizer vaccine only comes in lots of 975. And so for a facility to utilize and receive the Pfizer vaccine, they first of all have to have a sufficiently large ultra cold storage freezer that can accommodate 975 doses. So they have to have a freezer. It's got to be big enough. It's got to have space in it. And then they've also got to have at least 975 people on their site that they can vaccinate. So these operational considerations also are part of the equation for which facilities get which vaccines. Based on what we know as to the second question, the clinical efficacy of the Pfizer vaccine and the Moderna vaccine are statistically equivalent to one another across all age groups.
Okay, so here's asking, just to clarify for the first part of that, about long-term care facilities. Those aren't the places that have the freezers, the hospitals do, correct?
Oh, well, staging areas at chain pharmacies do as well.
Okay, and then the other question is, is it known what type of allergies predispose people for an allergic reaction to this vaccine?
It is not entirely characterized. What we can surmise based on the individuals who have experienced an allergic reaction thus far is that a prior history of different types of allergic reaction may predispose somebody. Here's what I mean by that. Based on the cases that I've been briefed on that have occurred across the United States, the allergic reactions have occurred in individuals who, for example, had a shellfish allergy, or who had severe asthma, or had allergies to other medications. There isn't one unified sort of concept of allergy that predisposes folks to an allergic reaction to the COVID vaccine. The other thing to keep in mind is that there have been over 1 million doses of COVID-19 administered, and just a small handful of these allergic reactions. What I mean by that, Amy, is that not everyone with a shellfish allergy will have an allergic reaction to the COVID vaccine. Not everyone who has severe uncontrolled asthma, which can be associated with allergies, will have an allergic reaction. It's only a certain subgroup. Why that subgroup and not others, my colleagues in the immunology world would be able to discuss better than I. What it means for us, however, is that for those folks who have a history of allergies, they must be observed for at least 30 minutes after they receive the vaccine. And that's what's happened in Maine. And that's why, for example, we caught the case that we did last week.
Great, thank you.
I'm going to turn things over to Patty White next at Maine Public.
Thank you, Dr. Shah. In terms of the vaccinations for providers who work outside of hospital systems, understanding that you're hampered by a limited supply of doses and a lack of clarity about how many doses we can expect, beyond a week or so, can you give any kind of estimate for when these providers could reasonably expect to get vaccinated?
Yep. So Patty, my concept here is that this is like an expanding set of concentric circles. And at the very center are the groups that I've mentioned: frontline hospital-based workers, EMS clinicians, home health. There's another circle thereafter, which are individual healthcare providers who, for example, I'm not necessarily putting these groups into that order, but for example, who work with the highest risk, most vulnerable patients. This may be folks who work at dialysis centers or in cancer and oncology infusion centers. And then there's another circle thereafter, and then another circle thereafter. We are hoping within the coming 2 weeks to be able to start expanding those rings outward and outward and outward. We are doing so, again, wanting to shore up everyone who practices in that inner circle first. For example, not every EMS clinician in Maine has gotten their vaccine yet. Not every home health provider, not every frontline hospital worker yet. So we are still focused on that innermost circle, but hoping next week and or the week thereafter to begin expanding the ambit of those circles to say those who work with dialysis patients, those who work in oncology, those who work with other high-risk patients. It is a bit of a balance because there are these operational considerations that I mentioned with Amy. For example, does a location have the requisite type of storage and freezing capability? Have they got a provider agreement in place? Are they used to administering mass vaccinations? Many of these sites already are, so I don't mean to suggest that's an exclusionary criteria, but at the same time, we've got to make sure the logistics are all shored up. The worst thing that can happen is that we deliver a vaccine to a group before they are 100% ready, when that vaccine could have been utilized in someone else's arm. So let me just say really quickly, Patty, I absolutely hear, understand, and agree with the concerns that independent medical providers have expressed. I absolutely do. I don't quibble with it one bit. It is just a question of how quickly we can race through that inner circle so we can start expanding outward.
Got it. And how have you been able to determine how you're going to get in touch with independent providers just to let them know? And I'm thinking even beyond sort of traditional like primary care physicians, about behavioral health workers, kind of that whole group in the healthcare realm.
Exactly. So I think what we are going to most likely do as our first venue is to work with their respective professional societies. So for example, for mental health providers, work with their respective society. For dentists, who are also top of mind for us right now, given that they work in close proximity and are conducting aerosol generating procedures. We'll be working most importantly and primarily with the Dental Association. Similarly, just later this afternoon, we're meeting with medical providers as well. So I think that will be the mechanism of how we get in touch with them. To put that into a bit more of a rubric, Patty, this process involves 3 distinct buckets or work streams. One is identification. Who are we talking about? What ring of the circle we're in. Number 2, notification, the question you asked, how are we going to let folks know? And then number 3, vaccination. The vaccination piece is a logistical question. If a provider happens to be at part of a clinic that has an agreement on file with at least 100 people at it, let alone 975, we can reasonably ship an entire pallet of vaccine to them. But if they happen to be at a clinic that only has, say, 20 people at them, maybe the better thing and the more logistically straightforward thing to do is to have folks, rather than shipping vaccine to them, because it only comes in lots of 100 or 975, maybe it's easier to have those folks go to a central location. Those are the really difficult logistical questions that we've got to have strong answers on and get it right before we go too quickly.
Okay, thank you.
Mm-hmm. I'm going to turn things over to Joe Lawler next.
Yes, hi. Just a few questions about vaccine distribution. I know you said you received 17,180. What types of shipments are you expecting this week? And are the shipments this week also less than what you were originally anticipating?
By a little bit, Joe. So this week, we are expecting to receive in Maine 19,125 doses of vaccine. The breakdown of that is as follows. And so just to level set, Joe, this is week 3 of Operation Vaccinate Maine. Week 1 was the week of December 14th, week 2, the week of the 21st, and now here we are in week 3. Week 3 encompasses roughly 19,125 doses. The breakdown of that is 10,725 Pfizer doses and 8,400 Moderna doses. Those vaccines are going to different and respective places. We posted the allocation on our website last week as well, but generally speaking, about 8,000 of those 19,000 doses are going to be directed to long-term care facilities and the staff who provide care for them. And the other approximately 11,000 will go to non-long-term care facilities, EMS, hospitals, home health. I don't think I answered your question though, Joe. What was your question exactly?
So is the shipment that you're expecting this week, is that also less than what you were anticipating, or is it about the same?
No, it was less than what we were anticipating. What we thought we were going to get roughly 1 week ago today was about 350 more doses, 370 more doses than what we are actually going to be receiving this week. That is the second week in a row when we are receiving less than what we were initially projected to receive.
Okay, and sorry, just to, but the amount that you're being shorted by is less than the amount that you were shorted by previously. Is that correct?
That's correct. In the previous week, in week 2, we received approximately 36% less of the Pfizer vaccine than we were initially told. This past week, it was a smaller amount by which we were shorted, which is a good thing, but still not what we were told. And 350, 370 doses, that's a sizable amount when we're talking, for example, about smaller community practices, practice groups, oncology clinics, dialysis centers, dental offices. That really adds up. So those when what we get doesn't match what we planned for, we've got to go back to the drawing board and redo all of the math to make sure it still adds up.
Okay, and then just a couple of little things, just to triple check what Patty White was asking you about. So I think what you were saying is that for, like, say, an independent health care provider, that the independent healthcare providers should expect vaccine clinics to be coordinated with the Maine Medical Association?
Or their respective professional society.
Okay,
if it's a dental practice, and I don't want to overstate it, Joe, I don't know that it will be coordinated with those professional groups. We are working with and consulting with those groups, among many others. We're getting input on the best way. So on the best way to deliver vaccine to particularly smaller independent medical practices. There are large multi-specialty practices across Maine who, because of their size, can receive a direct shipment of vaccine because none of it will go to waste. But a smaller practice, we're getting input on how we can deliver vaccine to them, or by converse, whether it makes more sense to ask those folks to go somewhere. We're exploring whether maybe we can conjoin practices. So maybe 4 practices that have 25 staff members each could join forces and get one shipment, although that requires logistics unto itself. So maybe the ultimate thing will be to ask those folks to travel a bit of a ways to get vaccinated at a central location. That's what we are getting input on from a number of different venues right now.
Okay, and sorry, just one last little thing. I know you said about 10 days ago or so about people getting the vaccination cards when they get as proof of vaccination. Will they be getting those in digital form, and also will it count as proof of vaccination or just be like a reminder card?
Well, so there have been discussions at the US CDC level about precisely what you're discussing, Joe, whether there will be an electronic verification form that indicates that someone has received both of their doses, when they got them and what lot number, whether it will be just the old school paper method akin to the yellow fever cards that many folks may have seen if they've traveled into a number of countries. The US CDC is trying to come up with a unified system so that all states are doing it in a largely uniform fashion, and you don't have this piecemeal approach of 100 different apps out there that purport to be able to verify your vaccine status. So I don't think there's been a final answer from the US CDC, although I am aware that they are trying to come up with something uniform. I'm going to turn things over to Allison Ross next.
Hi, Dr. Shah, thanks so much. So just kind of speaking back to the vaccinations, but more specifically, just talking about dentists, you've mentioned them a few times, and I know you kind of can't say when they're going to be vaccinated, but is there any estimate on a timeline? And then members of the Maine Dental Association have said they would be willing to help with the vaccination efforts. Is that something that Maine CDC is still considering?
Sure. So Allison, again, I am fully on board with getting everyone within phase 1A, dental providers and dental professionals included. They are in close proximity to patients, often in settings where aerosols are being generated. So we are working as hard as we can to make sure they have access to vaccine. I really can't speculate as to when that may be, just to be candid. We're hoping it's soon. I want to assure every single member of the dental community who's watching right now, you haven't been forgotten about. Are in line, how quickly that line moves is governed by how much vaccine Maine receives. That's really the brake on the system right now. So Allison, I hear where you're coming from, and I most definitely hear where our dental colleagues are coming from. It is a question of when, not if, and how quickly that proceeds is really governed by how much vaccine we get. As you heard me just mention to Joe, our week 2 allocation was for Pfizer about 30+% lower than we thought. And our week 3 that just is coming in right now was about 300+ doses less than we thought. Unfortunately, being shorted in that fashion has system-wide implications. It's on its way, but I don't have a firm date. I know that's the one thing that everyone wants. It's the one thing I wish I could provide. Hopefully I will be able to soon, but at the same time, I don't have it right now and I don't want to overpromise. Now, we absolutely applaud and thank our dental colleagues for their assistance and willing to volunteer with us. We will certainly need all hands on deck as we get more into phase 1B and 1C, which will involve vaccinating larger numbers of Maine people in very high throughput fashion. I don't know to what extent and where dental providers may be best able to help, but we definitely look forward to welcoming them to the table.
Great, thank you.
I'm going to turn it over to Emily Tadlock next.
Hey, Dr. Shah. So my first question is actually about Eastside Nursing Home. A couple of my colleagues have reported it. I just needed some confirmation on how many cases we're seeing there.
Sure. So as of, Emily, the latest numbers that I have are as of yesterday. I haven't touched base with the outbreak investigator to update my numbers as of this morning, but as of yesterday, we were reporting 36 total cases, 23 of which were among residents and 13 of which were among staff members. That number may have gone up, and as they are conducting additional rounds of testing, as you're aware, Emily, it is likely to go up. So that's the number I've got as of 26 hours ago.
Okay, thanks. And then my next question kind of goes on what we were talking about at the last CDC briefing, and I just kind of want to ask it in a different way. So there are a lot of numbers and figures out there on the Maine CDC website. So what number or metric should Mainers be looking at for an accurate representation of what's happening with the virus day to day versus, yeah.
Yep. It's a question I ask myself. It's a question my mother asks me on pretty much every single day. And here's what I tell her. I asked my mom to take a look at really one number right now that tells me where things are, and that's the hospitalization rate. The hospitalization rate kind of sums up not just what is going on in the community, but also the severity of what's happening. Generally speaking, we've seen a certain percentage of folks who have gotten COVID needing to be hospitalized, and it's varied, and I can get you some of the models or figures that we use. But the hospitalization rate is one of those numbers that is reported to us every single day by the hospitals, Christmas, Thanksgiving, New Year's Day included. It is based on a fixed number of variables. That is to say, unlike positivity rate, which has that denominator of how many tests are being done, hospitalization rate is relatively fixed. And it also, again, in a glance, tells you what's going on both in the community, as well as gives you a sense, to Brad Rogers' earlier question, about where we are with respect to preparedness and capacity in our system overhaul. So that's one of the numbers that I look at. Earlier in the pandemic, I really focused on positivity rate because our goal was to expand testing. And positivity rate really helps you get a sense of whether you're testing enough. I still look at that. So the second number I look at after I take a look at hospitalizations is positivity rate.
So then I kind of had an idea that you might say that. So can we break that? Can we make that number, that positivity rate, more predominant on the website for people? And then is there any way that we can see that positivity rate for each county? Because a lot of people are really wondering what's happening in their specific county, in their specific community. Is there any way we can see that?
Sure. So Emily, as to the former question, we just updated our website in light of what you noted late last week with a brand new set of data visualizations that break out the positivity rate as well as where we are with our tests that we're reviewing. And we put all of that in a brand new visualization on the website. So I think that is there. We also further break out the positivity rate, as I've done previously, by PCR as well as antigen. Even though they are both markers of infections, which is important, it's also important to keep them separated to some degree. So that's on our website and should be. So that's a way, and it's right up top. It's even before the tables with all of the data and everything. Now, with respect to breaking it out by county, we've looked into doing that. It does require, it's something we can do, although, and we can look into that further, Emily, although I think what I'm about to say will not surprise you, which is that the virus is everywhere. And although the positivity rate, which by the way, is on a PDF, it's not visualized, but it is found on our website. We're not hiding those data. There's a PDF that you can click on that's updated every Thursday with the latest positivity rate and case rate by county. It's just not graphically visualized. So that is on the website. It's just important to note that while it's always a good idea to know what's going on in your backyard, it's just really important right now to recognize that the virus is everywhere. And as I've talked about previously, there is a trade-off between letting folks know what's going on in their backyard or front yard and not providing a false sense of security. So not having people say, well, in my zip code, there's only been 7 cases, so it's fine for me to do whatever I want to today. Or the positivity rate in my county isn't as high as it is in the adjacent county, so I'm fine. But as we know, the virus is everywhere and it doesn't respect those county borders. So I think we just have to acknowledge, Emily, that there's a trade-off. But bottom line, both of the things that you asked for and noted are both on the website.
Awesome, great. I kind of did assume you were going to say that. I do have a question from a viewer. She wanted me to ask, should people with an autoimmune disease like lupus or something like that be getting vaccinated? So
according to the US CDC, there is no contraindication for folks with autoimmune disorders like lupus and others. There is no contraindication to getting the COVID vaccine. But if folks have concerns or questions, they should check in with their primary care physician or their rheumatologist to make sure. There is no official contraindication, but as is so often the case when it comes to things like COVID, individual circumstances may vary. So I can't provide any medical advice, I can say there is no contraindication, but for folks who have more questions, they should absolutely check in with their primary care doctor or their rheumatologist.
As always, thank you.
You are welcome. I'm going to turn it over to Isha next.
Thank you, Dr. Shah. I apologize in advance for being the third person today to ask you about vaccine statistics, but that's what my first question is. So over the past 3 weeks, can you tell me what is the total number of vaccine doses Maine is short of the expected total by, and why is this delay happening?
Okay, so let me do the math real quick on the total number. Actually, Isha, I don't want to get it wrong. I have it generally in my head, but I want to make sure I carried the zero right. So I'll get you the exact number. It's on the order of a couple thousand doses, though. That's between week 2 and week 3. And again, we'll get you the exact number in just a bit. But in week 2, we were down about 36% of the Pfizer vaccine based on what we thought we would get. And then in this current week that is starting right now, as I mentioned to Joe earlier and Patty, it's about 350 doses. We'll sum that up and get you the exact number.
Okay.
This is not a function of Maine CDC. This is a function of Operation Warp Speed. Even though I use words like order from time to time, the reality is that what happens is that in the early part of each week, the state of Maine receives from Operation Warp Speed, we are told what our allocation will be for the subsequent week of both Pfizer and Moderna allocations. We are given that number, those aggregate numbers, and then we in turn have to let Operation Warp Speed know the names and addresses of where we want those boxes shipped to. Whether it is Pfizer going to Medical Center X or Moderna going to a home healthcare agency Y or EMS agency Z. We provide the names and addresses and they drop ship them to them. So it's not really an order as much as it is being told by Domino's how many pizzas you're getting and you just telling them where you want them delivered to. What we've been told in terms of why particularly the drop in the Pfizer vaccine, General Perna briefed state health officials 2 Saturdays ago about why that occurred. And he said it had to do with a 2-day difference between when the vaccine was being produced and when it was actually ready to be shipped. And there was, according to General Perna, a bit of a miscommunication on the Operation Warp Speed side. Basically, just because a vaccine had come off the production line didn't mean it was ready to be put into ultra cold storage and shipped out. And that difference led to the reduction. I believe and trust General Perna. I hope that we don't see that recur in the future, though.
Okay, thank you. My second question is about pharmacies. So do you know how many pharmacies in Maine have ultra cold freezer units for storing the Pfizer vaccine? And is there anything Maine CDC can do to help more Maine pharmacies get those storage units?
So the key here, Isha, is that it's not so much the pharmacy down the street that's got to have the ultra cold storage as it relates to the pharmacy partnership to vaccinate long-term care. Those vaccines are being held at central staging centers. Those are the places that have the ultra cold storage units. The lots are being broken up in painstaking fashion. It's pretty difficult to do that. And they are being dosed out, allocated out to the teams that are going on site to conduct the vaccine administration. So it's not as if your local CVS has an ultra cold storage. It's more that the mass staging areas that these commercial chain pharmacies utilize, they are the ones who have the ultra cold storages. We have not heard any reports of shortages of storage at those locations.
Thank you.
Mm-hmm. And to round us out for the afternoon, I'm going to turn to David Horowitz from ABC.
Yes, thank you. I have 2 questions. First one is for Dr. Shah, and the next one for Dr. Pollard. This may be a very hard question to answer, but do you anticipate now that vaccines are available and that they will eventually be widely available, that this will lead to the end of the pandemic? I understand that's the goal of the vaccine, but do you think this is the light at the end of the tunnel?
So it is definitely the light at the end of a very long twisting and turning and convoluted tunnel. It's going to take us time to get to the end of that tunnel. Make no mistake. It could be well into 2021 before the vaccination effort that we are undertaking comes to fruition. To think about it this way, David, of the 1,344,000 people in Maine, we've got to get shots into their arms twice. So that's about 2.68 million events that have to occur, vaccines that have to be put into folks' arms for us to get 100% vaccination. Even if we got to that point, the question you asked, David, is will this bring the pandemic to an end? Well, I think what large, massive scale vaccine will do will be to help us get back on the path to returning toward normal. I don't know what that world of normal will look like. Whether it will look like what things looked like a year ago in December 2019, or whether it will be some modified form. There is a notion out there that the vaccine will eradicate COVID from the face of the planet. That unfortunately will not happen. What is likely to happen, even after we have gone through this mass vaccination process, is that COVID will still be with us, hopefully in numbers that are small, but there will be from time to time outbreaks, flare-ups of COVID, perhaps among groups that didn't get vaccinated, perhaps among groups where there weren't enough people vaccinated. So while we all hope for COVID to be vanquished from the globe, that probably won't happen. What is more likely to happen, and what I'm hoping for, is that massive vaccination allows us to get back to the things that we miss so much. Being able to hang out with friends and family, being able to embrace each other, being able to be close to one another, maybe even being able to go to a concert. When that happens, that's the big question.
All right, thank you. And the next question is for Dr. Pollard. You spoke briefly about some silver linings, and I was just wondering that, personally, I've heard a lot of people talk about how they've gained perspective, and I know there's been a lot of negative things happening as a result of the pandemic, but do you think there is some positive that people have gained?
Absolutely. I think that, besides the one I mentioned, which is really demonstrating that we are capable of making telehealth widely available, which is important for people who lack transportation or who live in rural areas. I think for a lot of people, the way they've coped is expression of gratitude and focusing on the things for which we feel grateful and keeping things in perspective about what we do have and what is important to us. These things that we're missing, I do think that, it's fine for us to be sad or to be stressed out about the things that we don't have access to. But the way that we shift our frame to think about, how important it is that we take care of one another and how important our loved ones are to us and why we take these measures to protect them. I think that really important focus or increased focus on what matters to us is another one of those potentially positives out of a really difficult situation.
All right, thank you.
Thank you, David. And I'd like to thank all of our colleagues in the media for joining us this afternoon. I'd especially like to thank Dr. Pollard for joining and talking about the stresses and the strains that we are all feeling at this time of the year. Dr. Pollard, if you've got any closing words, I'll turn it back over to you. If not, we can wrap up.
No, just, I really appreciate the opportunity to talk about such an important topic and encourage people not to wait until they feel really poorly. If you're struggling even a little bit, if you're stressed out, don't wait. Prevention is just as important for mental health as it is for other parts of health.
Great. Well, thank you very much. And thank you all for taking a little bit of time out of your afternoon to join Dr. Pollard and me to hear about where we stand with respect to all things COVID-19 across the state of Maine. I hope everyone had a restful and helpful and productive holiday week. I hope you got to recharge a little bit. We've got another holiday week coming up. We will be joining you this week, not just today, but Wednesday, not being with you on Friday, but resuming in the brand new year with these updates and briefings. Until then, I hope everyone has a good afternoon. As always, please be kind and take care of one another. We will talk again on Wednesday. Thank you.